Many of us already know that smoking, they will say lung cancer, smoking causes lung cancer. But truly, it's not everybody who have smoked for a long time comes down with lung cancer. So, but consistently, it has been seen that many people that smoke long enough will eventually have lung cancer. So, because many people still smoke and don't have lung cancer, you may not say completely that smoking causes lung cancer. So, but we can say that smoking is a risk factor for lung cancer. So wherever you see risk factor, it's trying to tell you that many times in the presence of smoking, there is lung cancer, or we end up having lung cancer. So, but that doesn't mean that everybody that smokes will have lung cancer. So that's what risk factors are. So these cardiovascular diseases that happen to us, example of these cardiovascular diseases, we mentioned it before. Those that have hypertension that affects their heart, those that come down with heart failure, their heart will fail. That pumping action of the heart as the pump, the heart is unable to pump that blood very well to the whole system. That constitutes that becomes what we say is heart failure. Somebody can even come down with stroke as part of a cardiovascular disease. So there are so many cardiovascular diseases that as we go down the lane in this channel, we'll bring them up and talk about them so that you can learn and act accordingly. Alright, back to the risk factors. So what causes these cardiovascular disease we talk about? The risk factors, there are common risk factors that we know that in their presence with time, you end up having cardiovascular diseases. Some books will classify them as modifiable risk factors and non-modifiable risk factors. What it just means is that the modifiable ones, you can change, you can affect, you can change it, you can alter it, you can adjust it so that it doesn't cause these problems. Then the non-modifiable ones is that you cannot change it. Example of non-modifiable one is age. Everybody must grow old. So as you grow old, the older you are, the chances of having a cardiovascular disease increases. Race. If you are born and you are black, the black race, there is a little tendency for you to have more cardiovascular disease than somebody who is a white. Somebody who is a Caucasian, a white. What other thing? Sex or gender. It's been said that many of the male gender have more cardiovascular disease early in life, adulthood, middle age, that males usually have more. So these are things you can't change. You can't change the fact that you are a man, you are born a man or woman. There's nothing you can do about it. You can't change the fact that you are born black and not white. There's nothing you can do about it. You can't change the fact that you are going to grow old every day. Your age keeps increasing every day. You can't change that fact. So those ones are non-modifiable risk factors. Then the modifiable ones, as the main meat of the matter, the ones that you can do something about, I can do something about. You can advise people and they'll do something about them. The modifiable ones, hypertension that we started talking about is one of them, a major cause of cardiovascular disease. And hypertension we can modify by changing our lifestyle habits and also taking our medications. Same thing with diabetes. Diabetes is a risk factor, cardiovascular risk factor. It can harm from head to toe, but it's very controllable. You can control it with lifestyle changes, you can control it with drugs. Then there is one we call hyperlipidemia. It's not, don't break your head with the big word. That's the one you people always say, I have cholesterol, I have cholesterol. Cholesterol is not the only lipid. There are many other things you consider in their group before you say somebody has bad cholesterol and all. So that one is for the cholesterol side. Another one that you can modify is smoking. Smoking is a cardiovascular risk factor that can harm the cardiovascular system. So is something that is worth adjusting so that you can live better. Alcohol intake. Alcohol also is a risk factor and affects the cardiovascular system. So is modifiable, it's something you can do something about. Then we have obesity. That one, it affects many of us now. This time and season where we eat plenty, we don't walk much. The sign of big man is that we drive in our car and go to everywhere we're going to. We don't have time for exercise, and so obesity is a very terrible cardiovascular risk factor that can harm from head to toe. So obesity usually go with a sedentary lifestyle. So you may not be obese, but you are fond of staying in one place. Your work, you all stay in one place. You now drive home and you stay on the bed. You wake up, you continue the same cycle. You don't exercise. You don't map out time for exercise. That's a cardiovascular risk factor. So these are some of the common ones. There are uncommon ones too.